Some of the most dangerous signs of dog cancer don't look dangerous at all. A small lump you ignore, slight weight loss, a change in behavior you blame on aging. Cancer in dogs often starts quietly, and by the time it's obvious, precious time may already be lost. In this video, we're breaking down the early warning signs of dog cancer most owners miss, why they're easy to overlook, and when it's time to take action. Before we get started, if you want to protect your dog's health with awareness, not fear, hit subscribe. This is where responsible pet care gets explained. Lumps and bumps that appear suddenly. This is the most obvious sign, but people miss it all the time. You're petting your dog and feel something that wasn't there before. A lump under the skin, a bump on their leg, a strange mass on their belly. Here's what most people do wrong. They'd assume it's nothing, just a fatty tumor. Dogs get those all the time, right? And yes, many lumps are benign lipomas that are completely harmless. But some aren't. Some are mast cell tumors, melanomas, or other cancers that need immediate attention. The problem is you can't tell the difference just by looking or feeling. That small bump could be nothing, or it could be cancer spreading through your dog's system right now. Every lump needs to be checked by a vet. Every single one. And here's the thing people don't realize. Cancer lumps can grow fast. You might check your dog 1 week and feel nothing. Then 2 weeks later, there's a golf ball-sized mass. That's how aggressive some cancers are. The rule is simple. Any new lump or bump gets examined by a vet within a week. They'll do a fine needle aspiration, which is quick and relatively painless, and tell you if it's something to worry about. Don't wait. Don't assume. Don't convince yourself it's probably fine. Get it checked. Because if it is cancer, every day matters. Changes in eating habits nobody takes seriously. Your dog's appetite changes. Maybe they're not as excited about meals anymore. Maybe they eat half and walk away. Maybe they're suddenly picky about food they used to love. Most people think it's just a phase, or maybe the dog is bored with their food. So they switch brands, add toppers, try different flavors, and sometimes the dog eats better for a few days, so they think problem solved. But appetite changes are one of the earliest signs of cancer. Tumors anywhere in the body can affect how a dog feels about eating. Mouth cancer makes chewing painful. Stomach cancer causes nausea. Lymphoma affects the digestive system. Even cancers nowhere near the digestive tract can reduce appetite because the dog just doesn't feel well. And it's not always a complete loss of appetite. Sometimes it's subtle. They eat, but less than usual. They take longer to finish meals. They need more encouragement. These small changes add up. Weight loss is another red flag that people miss until it's obvious. You see your dog every day, so gradual weight loss doesn't register. Then someone who hasn't seen your dog in a month says something like, "Has he lost weight?" And suddenly you realize, yes, he has. By then, it might have been happening for weeks. The fix here is simple. Pay attention. If your dog's eating habits change for more than a few days, don't write it off. Get them checked. And weigh your dog regularly. Once a month is enough. Keep a log. That way, you'll catch weight loss early instead of when it's already significant. Weird smells coming from your dog. This one sounds strange, but it's real. Cancer can cause unusual odors. A foul smell from your dog's mouth that doesn't go away with teeth cleaning could be oral cancer. A strange smell from their ears that keeps coming back despite treatment might indicate a tumor. Skin cancer can produce areas that smell infected even when they're not. And internal cancers can sometimes cause bad breath or body odor that's different from normal dog smell. Most people notice the smell but attribute it to something else. Oh, he needs a bath. Oh, her breath is just bad because she's older. Oh, that's just how dogs smell. But dogs shouldn't smell rotten or foul. Normal dog smell is one thing. The smell of decay or infection that won't go away is another. If you're noticing an odor that's persistent, getting worse, or localized to one area of your dog's body, it needs to be investigated. Don't mask it with dog perfume or more frequent baths. Find out what's causing it. Because if it's cancer, that smell is your early warning system telling you something is very wrong inside your dog's body. Breathing problems you think are just aging. Your dog is panting more than usual. They seem out of breath after mild exercise. They cough occasionally. They make weird breathing sounds at night. And you think, well, they're getting older. Older dogs breathe harder. Except that's not always true. Breathing changes can indicate lung cancer, heart tumors, or cancers that have spread to the chest cavity. Dogs are incredibly good at hiding discomfort, so by the time you're noticing breathing problems, they might have been struggling for a while. A persistent cough that lasts more than a week is never normal. Heavy panting when they haven't been exercising is a red flag. Rapid breathing while resting needs attention. Labored breathing or breathing with their mouth open when they're just lying around is serious. And here's what makes this tricky. These symptoms can come and go. Your dog might seem fine one day and struggle the next. So you convince yourself it was nothing. But cancer doesn't take days off. It's always there, progressing, even when symptoms aren't obvious. Respiratory issues in dogs require immediate vet attention. They might need x-rays to check for masses in the lungs or chest. They might need an echocardiogram to look at the heart. Don't assume it's just old age unless a vet tells you that after proper testing. Because lung cancer in dogs is aggressive, and catching it early gives you options. Catching it late gives you heartbreak. Limping or stiffness that comes and goes. If your dog starts limping occasionally after rest or exercise, it might seem like arthritis or a minor injury. But intermittent lameness can signal bone cancer, like osteosarcoma, which is common in large breeds. Early on, the limp comes and goes, so it's easy to miss. By the time it's constant, the cancer is often advanced. Early detection requires x-rays, not home care. If your dog has unexplained lameness that doesn't improve in a few days, see a vet promptly. Early treatment, like amputation and chemo, can give more quality time. Waiting can cost precious weeks. Behavioral changes everyone ignores. Behavior changes are often the earliest sign something is wrong with your dog. Less play, more sleep, withdrawal, or anxiety can signal pain, illness, or even cancer, not just aging. Dogs can't tell us when they feel off, so they show it through actions. Pay attention to their usual habits: sleep, excitement, play. Sudden, unexplained changes are a cue to check with your vet and consider tests. Don't dismiss it. Your dog is trying to tell you something. What makes cancer so frightening isn't just the disease. It's how silently it can progress. Dogs don't complain. They adapt. And that's why owners noticing small changes can make all the difference. Early detection doesn't guarantee outcomes, but it gives your dog the best possible chance. Awareness is not panic, it's love in action. So tell me, have you ever noticed a small change in your dog that turned out to be serious? Share your experience in the comments. It could help another owner. If this video helped you feel more prepared and informed, don't forget to like, subscribe, and share it with someone who loves their dog like family. Thanks for watching. I'll see you in the next one.